Getting the right medicine to the right patients is only part of the story. Once the patient is safely back at home, how do you make sure that they take the medicine or take it as they're meant to? Some estimates say that half of patients with heart problems will make mistakes with their medication within a month of leaving hospital. The OneHeart programme is a collaboration between AstraZeneca, Atlantis Healthcare and the NHS, and it's been getting some great results, as Jonathan Gibson explains.
Big breath in, breathe out.
4 months after his heart attack, Christopher Diakopoulos is making progress, but he's had to adapt.
You have to face the two basic fears. Am I going to die? And I have to take these pills for the rest of my life. And that's quite difficult if you haven't been on a drug regime or had any major illness.
Making sure patients like Christopher keep taking their medication is a key priority for the NHS, which spends just under £13 billion on medicines every year. But research within cardiology reports that almost half of patients stop taking their oral antiplatelet medicine within 12 months of leaving hospital. It's one of the reasons the NHS and pharmaceutical industry are working together to support medicines optimisation.
Medicines optimisation is not medicines management repackaged. It's about working across and within professions to a whole new level, to supporting patients in using medicines well, to working in teams and professions, to be able to ensure that there is better outcome from medicines, better quality and ultimately better value from medicines overall.
There's a whole range of ways we can partner with the NHS in terms of making sure that our medicines, which we truly believe bring great benefits to patients, are used in the right way, in the right patient to get the best outcome. But also used in the right way, they can often have an impact on the rest of the healthcare pathway. For example, reducing hospitalisation costs for the NHS, or we can work with patients to support education and compliance programmes.
Here at the Bristol Heart Institute, AstraZeneca is working in partnership with the cardiology team to introduce the OneHeart programme. OneHeart is a personalised programme helping patients like Christopher manage their condition when they leave hospital, using magazines, DVDs and texts to support their recovery, and includes long-term medication.
The problem that we have experienced more recently is that the speed with which patients pass through our service in hospital results in them potentially not having sufficient time to understand precisely the impact of the diagnosis that they've been given. And so the OneHeart is one way of assisting in improving that drug compliance, but also in offering patients really much better support than we can potentially provide through our current rehab service as it stands.
It provided one of the things that you feel you don't get, which was information.
It's more support, it's earlier support, and it hopefully gives the patient even better idea of what's going on and what they need to do in order to prevent long-term trouble.
Simply put, we're moving away from looking at a medicine as just an acquisition costs and thinking about a medicine as the opportunity to really drive great patient outcomes. So for me, medicines optimisation is really about getting the full benefit from a medicine, almost thinking about it as an investment rather than just a cost.
The industry has to be a critical partner in medicines optimisation, but that needs to be done in a way which is value for money, for the public purse, which is transparent. At the end of the day, medicines optimisation will be core business for the NHS Commissioning Board, and I really hope it will be core business for the pharmaceutical industry too.